And if we're not sharing stuff to edify one another, to build each other up, then it's really not worth sharing. Let me introduce our sister, Monica Smith. A lot of the family in the house, clap it up for the family. I ran into Monica on my journey at Joliet Central. She worked with a lot of the students, and one thing I noticed about her, and that I noticed to this day, is that she has a pure heart to help people. That's, to me, when I see her and think about her, that's her primary motive and intention is to help individuals. I've always noticed that about her. It stays true to this day. She's a passionate advocate and influential speaker. We prophesy that. Dedicated to elevating awareness and support for mental health with minority communities. She has a profound commitment to addressing the unique challenges faced by minority groups. She brings 15 years, clap it up for 15, almost 2 decades, and experience in community engagement and mental health advocacy to help to her powerful presentations. Recognizing the intersectionality, try to trick me with that word, intersectionality of identity and mental health. She focuses on empowering marginalized communities to embrace mental wellness and seek culturally sensitive support. Monica's compelling task explores topics such as breaking cultural stigmas, intersectionality, yes ma'am, and mental health, culturally competent care, healing trauma, resilience, and empowerment. She engages her audience with empathetic stories, lived experience, and evidence-based insights. Her ability to bridge cultural gaps and connect authentically resonates deeply with audiences from diverse backgrounds. Committed to creating tangible change, she actively collaborates with community organizations, healthcare providers, schools, advocacy groups to promote mental health equity and culturally responsive care. Lastly, she leverages her platform to amplify underrepresented voices, advocates for policy change, and provide resources tailored to the needs of minority communities. Please give Ms. Monica Smith a round of
Thank you. Good morning, Kim. Good morning. First and foremost, thank everybody for being here. Like Brother Cage said, you could have been anywhere else on a Saturday morning and you chose to be here, so I am boundlessly grateful for that. As we get started, you will need your phones or electronic devices to engage. I like to engage with the audience and make the presentation interactive. So there will be QR codes throughout the presentation that I'll ask you to scan, and then there will be anonymous polls that we will be able to project on the screen and see the results, but nobody will know that that's your answer. So throughout the presentation, we'll have some different visuals and video, short like clips. So if you have your phone or a tablet, I just ask that you participate and engage so that we can make this engaging and learn through engagement at the same time, okay? Right. So today we're talking about mental health awareness and education in the Black community, breaking stigma, building resilience, and promoting Black wellness.
Don't you got to point it at the TV?
Oh, the computer. Smart. Okay. So, a little bit about myself. I was born and raised here in Joliet, Illinois. I made this word up. I'm a teen parent alumnus. So I was a teenage mother of 2 by the age of 19, overcoming adversity and struggle here in the community, beating statistics. So if I have any other teen parent alumni here in the audience, would you please raise your hand so I can see where my people are? Wow, wow, round of applause. I graduated with my bachelor and master's degree in social work from the University of St. Francis. Like Brother Cage mentioned earlier, I have over 15 years of experience in the mental health field and social services. I worked for the past 13 years as a school social worker at Joliet Public School District. So I did my first year as a school social worker with Joliet Public Schools 86. And the last 12 years of my school social work career, I spent at Joliet Township High School, the Central Campus, until I was released from that assignment by God last year. And I also have experience with medical social work, so I worked at Silver Oaks Behavioral Hospital. 5 years of private practice, so I also see a small caseload of clients for individual therapy. I am the owner and clinical director of RISE Counseling and Consulting. RISE stands for Resiliency, Yield, Self-Empowerment. So when I was released from my assignment at Joliet Central High School last year, I founded RISE Counseling and Consulting. I'm also certified to complete drug and alcohol evaluations for the Department of Transportation. So like if an essential worker or a truck driver had, let's say, like gets a DUI or was under the influence and got cited for it, and before they return to work, they need to have this evaluation. So I'm also certified to complete those evaluations. I have a contract with Maximus Clinical Services. They also contract with the Illinois Department of Human Services, so I complete mental health assessments at hospitals, nursing homes, in the community, assisted living facilities, so that people can get long-term care. And then lastly, I do a little bit of work at Lewis University, so part-time I'm the program coordinator for a program with my old school district. Joliet Township High School, so I mentor school social work and school counseling interns who are students at Lewis University so that they can be prepared to enter the workforce. And then I do, Lewis University contracts with my business to do some work with Valley View School District and Fairmont School District. And that QR code, it'll be at the last slide too, but it's a virtual business card, so it has my contact information. So a couple disclaimers before we get started today. I just want to remind everyone that this presentation is for awareness and education purposes only. So while I am a licensed clinical therapist, I'm not entered into a contract to be your therapist at this time. So I do want to say that this is for educational purposes only. So it's not meant to diagnose anyone or for anyone to diagnose themselves or Google doctor. So I just want to put that disclaimer out. So if you or anyone that you know is having concerns for their mental or physical health, I just encourage you to seek some advice from your primary care physician or a licensed clinical mental health person or psychiatrist outside of this presentation. And then if you are experiencing a crisis, a mental health crisis, or someone you know is, I highly encourage you to call 988. Okay? So before we get started, I am going to ask you a favor. So if you are able to stand to your feet, will you please stand to your feet at this time? So I want you to look at the person to your left and look at the person to your right. Okay? So whatever you feel most comfortable with, whether that's a fist bump, a high five, a handshake, or a hug, I want you to take the time to greet your neighbor right now.
Greet neighbor.
Okay. So, congratulations, because that's what a miracle felt like. So you don't know just by looking at someone what they've been through or what they're going through. So I want you to know that you just touched a miracle. So round of applause for everybody here. Because we're all here today. And again, you guys are also taking one step toward breaking the stigma by even being here to listen, talk if you're going to talk at some point throughout the presentation, but that's what this is all about, is breaking the stigma and talking about it, because that's what we don't do oftentimes as Black people, is we don't talk about this stuff. Okay? So you may be seated.
Hey, what's up? I need to talk to you. Okay, what's going on? I think I'm depressed. Girl, if you don't get out my face. And what was funny about what I just said? Because you're not. Go depress them dishes in that sink. That's what you can do. So you think doing the dishes is gonna make me feel better? Is that what you're saying? What I'm saying is you're not depressed. And how do you figure that? You must have just broke up with your boyfriend. No, I guess I'm just confused because you got a roof over your head, you always get your hair done, so I'm trying to figure out how you can be depressed and you got all of this stuff going for you, so help me understand. And I'm grateful for all that. I'm grateful for the hair, I'm grateful for the house that we're living in, I'm grateful for all of that, but that still don't change the fact that I'm feeling the way that I'm feeling. You can't just tell me that I'm not feeling a certain type of way and tell me to do dishes to make me feel better. Like, that's, come on now. Well, first of all, I can tell you that you're not depressed because one thing, I done been there and I done done that. This is just a phase. Go depress them dishes, like I said. Okay, whatever.
So our first interaction, and that's a lot to unpack, right? Because how many of us have heard that before ourselves, guilty of saying that to our loved ones, is that we, Black people just have this notion that, and not all Black people, so, but we have this notion that mental health isn't real, or that kids even can't be depressed because they're kids, and because we pay all the bills, they can't be depressed. So again, that's why we're here today, to talk about these things so we can break these stigmas and break these barriers to people talking and getting the support they need. So the first interactive thing that I want you to do is the question. So if you scan the QR code, well, now that they activated it, you scan the QR code, and the question is, what are some creative, so depressing the dishes, I call a creative coping skill. So we all have coping skills, whether it's healthy or unhealthy, realistic or unrealistic, but I call, like, depressing the dishes creative coping skills. So growing up in a Black household, what are some creative coping skills that you've heard? So just take a couple of minutes to, okay, somebody said listening to music. All right, listen to some music and your depression will go away.
If anybody needs help, just raise your hand. We got a couple of people that can help you out with it. Corinne and Josh.
Going to church. And again, these polls are anonymous, so nobody is seeing what you, that is your answer. Praying, going outside to play, go take a nap, go somewhere to think, eat. If you go eat, your anxiety will go away. Yep. Take a nap and you won't be schizophrenic anymore. Sleep. Sleep is a big one. You go to sleep, you won't be bipolar anymore. Just go to sleep.